Good afternoon, everyone. Welcome to the Cell Talk activity. For today's Cell Talk presentation, Jay is the presenter, and the topic he selected is Healthy Lifestyle and Life Expectancy at age 30 years in the Chinese population, an observational study. Before going to the actual talk, I would like to introduce Jay. Jay is currently working at Renix Life Sciences, focusing heart rate and sleep data. His primary responsibility involves analyzing this data using various statistical techniques to extract meaningful insights. Presently, he is dedicated to work on heart rate data. Jay is the fourth year undergraduate student in the Department of Biotechnology at the Indian Institute of Technology, Kharagpur. He is enrolled in the Biotechnology and Biochemical Engineering program. Throughout his undergraduate studies, Jay has developed a keen interest in subjects such as bioinformatics, genetics and genetic engineering, advances in protein structure and functions, and machine learning. He completed his 10th and 12th classes in his hometown. Jay has acquired hands on experience in handling biological data and performing data analysis. He aspired to advance his career in the field of bioinformatics and machine learning. I request Jay to continue to start your presentation.
Hello everyone. Topic of my presentation is healthy lifestyle and life expectancy at age 30 years in the Chinese population. Title: Healthy life expectancy. Healthy lifestyle increases life expectancy. Topic selected is longevity and the year of publication is 2022. This research has impact on life expectancy, chronic respiratory diseases, cardiovascular diseases. Introduction. Understanding the impact of healthy lifestyle choices on life expectancy is essential for improving public health, as it reduces risk of chronic diseases, promotes longer, healthier lives. In this study, we will check effects of five lifestyle choices such as smoking, alcohol consumption, physical activity, dietary habits, and body shape on life expectancy of diverse Chinese individuals. General background. Previous studies conducted in North America, Europe, and Canada shows healthier lifestyle can increase life expectancy by 7.4 to 18.5 years. As China have different economic, social, and environmental conditions, this necessitates specific research on Chinese population. The Healthy China 2030 initiative aims to increase average life expectancy from 76.3 years in 2015 to 79 years by 2030. This study will also help in achieving the Healthy China 2030 initiative. Objective of the research. In this research, we will assess the association between individual lifestyle factors and life expectancy in Chinese adults. Along with this, we will also investigate the combined impact of these lifestyle factors on life expectancy at age 30 in the Chinese population. Methodology. Data sources. There are two primary data sources, China Kaduri Biobank CKB, which tells us association between lifestyle factors and mortality, and China Nutrition and Health Surveillance CNHS, which tells us population-based prevalence of lifestyle factors. Global burden of disease dataset tells us the population-based mortality rates. So let's talk about China Kaduri Biobank data in detail. So it was a nationwide cohort study with 5,12,725 adults aged from 30 to 79 years, recruited from diverse urban and rural areas of China. This study collected information about baseline lifestyle factors, anthropometric measurements such as height, weight, BMI, waist circumference, etc., and other health status. In the current study, participants with coronary heart disease, stroke, cancer, chronic obstructive pulmonary disease, asthma, or missing BMI values were excluded as these can put negative effect on the study. China Nutrition and Health Surveillance data. It was a cross-sectional survey conducted between 2015 to 2017 on adult chronic diseases and nutritional status with samples from 302 sites across China. For current study, provided prevalence of lifestyle factors by sex and age for adults aged 30 to 84 years were taken. Global burden of disease data contains comprehensive mortality data for cardiovascular disease, cancer, and chronic respiratory disease categorized by sex and age groups within the Chinese population. So we will be utilizing these three data for our study. Methodology. Five modifiable lifestyle factors, which are smoking, alcohol intake, physical activity, dietary habits, and body shape, were selected for the study. A low risk lifestyle means not smoking, minimum alcohol intake, engaging in sufficient physical activity according to age and sex, maintaining a healthy diet such as taking fruits, protein, fiber in proper quantity, controlling body shape indicators such as BMI and waist circumference. 1 point was given to a individual if he was following that low risk lifestyle factors, otherwise 0 point was given. So individual scored between 0 to 5 and scoring between 4 to 5 points on lifestyle score was considered as having a healthier lifestyle. Cox proportional hazards regression, employing age as the timescale, was used to estimate hazard ratio for mortality outcomes. The cause-specific mortality analysis using a regression model that consider the risk of dying from specific cause like heart disease, cancer, lung disease was done. Population attributable risk percentage was computed, which tells us what percentage of death could have been avoided if each participant followed low-risk lifestyle factors. Eriga's decomposition method was applied to identify major contributors from cause-specific mortality difference to the life expectancy gap between individuals with all five versus 0 to 1 low-risk lifestyle factors. Adoption of low-risk lifestyle factors. In the CKB study, only 2% of the participants had all five low-risk lifestyle factors compared to 3.2% in the CNSS. Demographic variances. Females, younger individuals, those with higher education, and urban residents were most likely to adopt a low-risk lifestyle in both studies because of the awareness. Effect on mortality. Smoking was consistently associated with increased all-cause mortality risk across both studies, while physical activity and healthy dietary habits showcase a decrease in all-cause mortality. Alcohol consumption and mortality. Former drinkers and heavy drinkers consuming more than 60 grams of alcohol per day had elevated death risk compared to light drinkers in the CKB study. Body shape and mortality risk. Participants which were underweight or obese, either general or abdominal, had a high risk of death compared to others. Consistency across diseases. Associations between individual lifestyle factors and mortality risk for cardiovascular diseases, cancer, and chronic respiratory diseases were generally consistent with those for all-cause mortality. Increase in number of cigarettes smoked per day leads to an increase in hazard ratio from 1 to 1.59, increasing the risk of death. Increasing the physical activity leads to a decrease in hazard ratio, implying high life expectancy. High diet score means healthier diet, and increase in diet score leads to a decrease in hazard ratio, which implies more life expectancy. Overweight, underweight, and high waist circumference is associated with increase in hazard ratio, leading to decrease in life expectancy. Increase in number of low-risk lifestyle factors from 0.1 to 5 lead to decreased hazard ratio from 1 to 0.63. Finally, there was 8.8 years increase in life expectancy for men and 8.1 years for women who followed all five low-risk lifestyle factors compared to those who followed only 0 to 1 low-risk lifestyle factors. Results. Daily smoking and high daily alcohol decrease life expectancy. The exact years are mentioned in the plots. Regular physical activity and healthy diet increases life expectancy. Maintaining a healthy BMI and waist circumference increases life expectancy. In this plot, we can see there is a consistent increase in life expectancy as the number of low-risk lifestyle factors followed increases. Discussion. The estimated improved life expectancy for men and women was mostly attributed to reduced death from cardiovascular disease, cancer, and chronic respiratory disease. The observed increase in life expectancy associated with adopting low-risk lifestyle factors was lowered to studies conducted in high-income countries, which were equal to 20 or more. The differences in the increase in life expectancy may be because of poor environmental condition, chemical contamination of food and water, bad air quality in developing country like China. Limitations. The question asked in CKB and CNHS were on the basis of self-reported lifestyle behaviors, which may bias the results. The study only captured lifestyle factors at baseline in CKB without tracking changes over time, as individual may change its lifestyle over time. Each lifestyle factor was simplified into binary categories. Either 0 point was given or 1 point was given, which disregarded the difference in magnitude. Definition of low-risk lifestyle factor varied slightly between CKB and CNHS due to the questionnaire differences. Impact of the research. Adopting low-risk lifestyle choices significantly increases life expectancy in Chinese adults at age 30 years, emphasizing the pivotal role of lifestyle intervention in shaping public health policies. And the research would also be helpful in achieving the Healthy China 2030 goal. And thank you for listening me. For any clarification, you can find me at jg@renix.org. Thank you.
Thank you, Jay, for your presentation. Audience, now the floor is open for any queries. Jay, we have one question from Nupur. Which one is the most affecting lifestyle factor?
Give me a second. Let me go to the slide which is mentioning it. So from here, we can see the most affecting lifestyle factor is the diet. Diet and the lifestyle factor like exercise.
Okay, we also have a question from Vijay. Was only the data acquired during the study period or older data of participant was also used?
The data was used from the CKB and CNHS study. New data was not acquired. Only the data for death was taken afterwards.
And I don't see any further questions. Thank you, Jay. Can you move to the next slide? So before closing the session, I would like to inform you regarding the next presentation. And the next presentation will be on 3rd July by Chaya. And the topic is Estimating Impact of Food Choices on Life Expectancy, a Modeling Study. Thank you, Jay, and thank you all for your attention.